So for the first exercise here, what you see is that we are doing body weight squats. Now on the left hand side, you will see that Dr. C is performing a more simpler version, which is a chair squat. So instead of squatting all the way down, like what I'm doing, Dr. C is actually squatting down to a chair. Now, though she's squatting down to a chair, the effect is the same. You're working the same muscles, which are your legs, your butt, as well as your core, which is in your torso. So how many reps? Well, for a start, you could actually start off with 10 reps and slowly build it up to 20. The main idea behind doing the bodyweight squats is to build strength and endurance in your legs. Now, your legs are very important muscles. They will allow you to do things like your aerobic exercise, walking, jogging, and of course, chasing after your kids. And so that's why squat is definitely going to be one of your main exercises that you can consider in your home exercise program. Now, before we can move on to the next exercise, all right, the second exercise would be push-ups. Now, the main aim of push-ups is to work your upper body strength. We are looking at your shoulders, your chest, as well as your core muscles, all right, in your tummy and in your lower legs as well. So you can see that it is not just upper body exercise, because now you are actually maintaining a straight plank, all right? You are actually engaging the body as a whole functional unit to go down to the floor and back up. Now for Dr. C, how she makes the exercise simpler is that she actually does the push-up on a chair instead, on the floor. Now this will shorten the distance, the range of movement that her body has to go, and therefore it makes it a lot easier. Now if you find that you are lacking a lot in upper body strength, you could follow the first example that I was doing, which is doing push-up on the wall. Now, progressively, when you find that you are getting stronger and the movement starts to feel easier, that's where you can actually start to progress your push-up to what Dr. C is doing, and eventually you can progress it to the full expression of the push-up that I was doing, which is doing push-up on the floor, all right, without any support at all, all right? So we are moving on to the next exercise, the lateral leg lifts. Now, when you look at the lateral leg lifts, it looks deceptively simple, but the main aim of the leg lifts is really to work on your abs as well as your butt. Now, why am I actually mentioning these two kinds of muscles a lot here? Now, the reason is because your butt is actually your butt muscles are actually the biggest muscle group in your entire body. Now, your butt needs to be strong so as to support your lower back. Now, a lot of people tend to have lower back discomfort or even pain as they age because they have not been strengthening their core muscles. And if you actually realize that your abdominal muscles and your butt muscles are actually closely intertwined, and so it makes sense for you to actually really intentionally work on your butt muscles, all right? Like in this instance, so that you can actually improve your overall core strength. Now, what are the main things that you ought to be looking at when you're performing the lateral leg lifts? Okay, for a start, if you find that you are feeling very unstable when you're doing this exercise, you could follow Dr. C's example by holding onto a chair. Now, how you're going to lift your leg? You just think of lifting it sideways like a ballerina, all right? You're going to lift it up, hold the paws at the top, feel the burn in the butt muscle, and then you lower the leg down with good control. Now, how many reps? Again, you can actually start building up from 10 reps all the way up to 20 reps. There is no hard and fast rule. Essentially, what you are looking at is really to create that burn, to know that you are actually training the mind-muscle connection so that you know how to engage the muscle effectively when you are doing your daily activities of living, all right? So we can move on to the next exercise. Now, the next exercise is the plank. Now, Dr. C is going to perform the simpler version of the plank here, all right? She's going to hold the chair for support slowly, She's going to kneel down to the floor, all right? And the knee will be supported by a mat, all right? And then she's going to slowly move her forearms onto the floor, all right? With her knee still on the floor, she's going to hold the plank position. Now, how long are you going to hold this position? Again, it's subject to how much your body can hold, how much your muscles can endure. So typically, for a start, if you're not sure how long you can hold, right, you can probably hold it for 15 and slowly build up your endurance to 20, 25, 30, and eventually even 60 seconds. Now, what this exercise does is that it targets your core muscles, your abdominal muscles, the abdominal girdle that actually helps to support your low back and your hip bones. So what this does overall in the long run is that you're going to find that you feel stronger, you feel more upright, you feel less tired when you are walking, jogging, or even climbing stairs, because now you're actually training your body as one whole functional unit. Now, on the right-hand side, you can see that I'm holding the full expression of the plank. This is actually the most advanced version of the plank. Now, if you can't do this yet, you should consider and you should definitely do the simpler version of the plank, because if you actually overexert yourself in this exercise, you might find that you feel a lot of discomfort in the low back, and that is not the intention of this exercise. In this exercise, you should feel mainly in your shoulders, but more importantly, you should feel the bulk of the burn, all right, the core activation in your abs and in your legs, all right? Now, we're going to move on to the last exercise here, all right? The last exercise is the glute bridge. Now, when you look at the bridge, all right, you can see why this is called a bridge. Now, on the left-hand side, Dr. C is performing the simpler version, all right, with her knees bent, and on the right-hand side, I'm doing the more advanced version with my legs fully straightened. Now, what this exercise does, again, it targets your core and your butt muscles, okay? So in order for your body to hold and maintain this position, your body needs to have certain level of strength in your abs, in your butt, your thighs, in your legs. So what this does over time, when you hold this position for longer and longer periods of time, you're actually training the strength and endurance in all these body parts. So overall, when you combine this exercise with the four exercises that we have shown earlier on, you're going to find that in this basic home environment, you're going to find that you get stronger faster. You're going to find that you don't feel so tired as easily when you are performing certain activities like squatting or standing for long periods of time, simply because we are targeting a lot on your core strength. So how long again to hold this position? Well, again, it's really up to you. You could actually start off with 15 seconds, 20 seconds, eventually, adding it all up to 60 seconds. There is no hard and fast rule, because at the end of the day, all these exercises are customized to what you can do safely on your own. Now, if you're able to have access to a personal trainer or someone who is like myself, who actually works specifically with cancer patients or patients with chronic diseases, you'll find that we will progress you gently. We would never advocate you to overexert yourself to the point where you feel so exhausted and utterly spent after doing this exercise, which is totally not the intention of exercise, because exercise, if you do it correctly, it should not exhaust you. It should instead invigorate you, which is really what Dr. C talks about in terms of improving the quality of your life. So with all this shared, I would like to invite all of you to actually do this together, all right? So Li Fang is going to play the video, all right, so that you can actually see how in real life you're going to do these exercises together. So before you start the squat, right, probably you want to actually set aside a chair, right? You can start off with squatting on the chair, up and down, right? So how far apart your legs? Probably about at least hip width apart, with your toes slightly pointing upwards. So you can just think of sitting down and standing up, sitting down and standing up, and feel the burn in your thighs. So once you're done with 12 reps, you can actually move on to your push-ups. So at the beginning, if you're new to the exercise, I would recommend that you do the push-up against the wall. All right, so if you recall, you're just standing close to the wall and then you're lowering yourself as close to the wall as possible. So where you're going to feel, you should feel it in your arms, your shoulders, and your chest. So for good 12 reps, and once you're done, we're going to move on to the lateral leg lifts. So for the lateral leg lifts, all right, 12 reps each side. Okay, if you can't hold your balance again, it's absolutely okay to hold on to a chair or a wall for support. So where you're going to feel the burn, you're going to feel the burn on the leg that is standing. You're going to feel the burn at the back part of your hips, which is the butt, and even the calves. So once you're done with 12 reps on one leg, you're going to switch side. You're going to do 12 reps on the other side as well. Okay, so now once you're done with the leg lifts, you're going to proceed to the plank. Now, I would definitely recommend that you follow Dr. C's example, which is actually to do the kneeling plank. Right, so slowly get down onto the floor with support, and then get onto your forearms. And then you're going to hold this position for 30, 40 seconds. Is entirely up to you. The main thing is in this session, in this webinar, you can actually start experiencing your body, start learning how your body responds to each movement. So in this exercise, you should feel some tension, some activation in your stomach, in your hands, and of course, probably some sensation in your thighs as well. And that's perfectly fine. All right, and then we are moving on to the last exercise. All right, so we're going to do the bridge exercise. So again, you can be easy with yourself since you're doing the exercise for the first time. Take lead from Dr. C, all right? So look at her, how she does exercises. So with the legs bent 90 degrees between the back of her thighs and the calves, she's going to lift her hips up and maintain this position for about 30 seconds. Now, if you find that your body is shaking, all right, towards the end of the exercise, that's perfectly fine as well, because that shows that your body is working hard to maintain that position. So once you're done with the glute bridge, you can move on to the second round of the same exercises that we did just now. So as you can see here, essentially resistance exercise is not complex at all. It's just choosing the right exercise to create the intended effect, which is to strengthen your core muscles so that you're able to do your daily activities of living safely and effectively. So all these exercises that Dr. C and I have selected are not fanciful exercises that you find on the YouTube channel. They are not meant to be acrobatic movements. They are very basic movements to actually help to improve your overall strength and, of course, your endurance to do your daily activities. So you can actually do these exercises whenever you want or whichever day you want. There are no hard and fast rules as to, oh, should I do it in the morning, afternoon, or evening? wherever you are able to do it and whenever you are able to do it in an uninterrupted way, it should be the best time for you to do your resistance exercise training. That said, however, more importantly, you should also look at it in the grand scheme of things. You should prioritize your aerobic exercise training, which is your jogging, your brisk walking, keeping it minimally 150 minutes a day. And then for strength training, which is your resistance training, twice a week with all these simple exercises, you should be able to find that there is some improvement in your overall strength. So at the end of the day, as I have mentioned again and again, all right, exercise has to go back to why. Why do you want to do exercise? What kind of effects are you trying to create? What is the outcome? Now, without the why, all right, it will be very hard for you to sustain any meaningful exercise program. And that is why after this webinar, I definitely would encourage all of you to actually start thinking what are certain things that you want to do better in your daily life. Could it be like you want to have better energy, you want to sleep better, you want to be able to, go back to work, within 3 months, a few months, without feeling so tired easily. And so with all these goals that you have in mind, that's how you are actually able to start designing the ideal, the optimal exercise program that best fits your lifestyle and your goals. So once this exercise program ends, we would be moving into our Q&A session. And at this point in time, I apologize for the slight overrunning of our session.
Thank you, Eleanor.
Yeah.